So, getting a nose job, a rhinoplasty, is obviously a huge decision. But what a lot of people don't think about is what happens after the surgery, the healing. And for patients with thick skin, that process can be really long and honestly pretty unpredictable. Today, we're going to look at the science behind two little helpers that might just be a game changer for getting the best possible result. Right? Let's just dive right into that question. Because what if the surgeon's skill, as crucial as it is only one part of the equation? This whole explainer is about that other half, the recovery, and how modern medicine is finding some really cool new ways to control it. Okay, so the first thing we really need to wrap our heads around is the core problem that surgeons and patients are up against. When it comes to rhinoplasty, not all skin is created equal. And thick, oily skin, well, that presents a very unique and pretty significant challenge. So, why is thick skin such a big deal? Think about it this way. Imagine a sculptor carves this absolutely beautiful, detailed statue. Now imagine someone comes along and just throws a heavy, thick blanket over it. You know that amazing statue's under there, but you can't see its shape, you can't see the fine details. That's pretty much exactly what thick nasal skin can do after a rhinoplasty. It can completely hide all the surgeon's careful, intricate work. And this leads to some very specific issues. We're talking about swelling that just will not go away, a real lack of definition, especially at the tip of the nose, and even the formation of something called fibrosis, which is basically a buildup of dense scar tissue under the skin. All of this can obscure the new nose shape and, lead to a result that's just not what the patient was hoping for. And this is where pharmacology can step in to help. So let's bring in our first helper, isotretinoin. You might know it by a brand name like Accutane. Think of this as a system-wide approach. It's a pill that works on your entire body to fundamentally change the skin itself, making it a much more cooperative canvas for the surgeon's work to shine through. So what is this stuff really? Well, at its core, isotretinoin is a super powerful derivative of vitamin A. Its main job in this context is to shrink those oil-producing glands and to actually thin out the dermal tissue. It's kind of like taking that heavy blanket we just talked about and making it lighter, thinner, and more pliable, so the beautiful shape underneath can finally show through. Now, this is where it gets really interesting. We know it helps, but the key is when it helps. Clinical trials show that isotretinoin gives patients a fantastic boost in those early months of healing. We're talking way less swelling. But after a year, that visible advantage seems to level out when you compare it to a placebo. So its real superpower is in managing that super critical early recovery phase. And this is a really big deal. For years, the rule book basically said that surgeons had to wait a long time, like 6 to 12 months after a patient stopped taking isotretinoin before they could do surgery. They were worried it would mess with healing. But recent reviews, like the one we're looking at, are suggesting there's actually no solid evidence for that long delay. And that shift in thinking could make this treatment way more accessible for rhinoplasty patients. All right, on to our second helper, triamcinolone. Now, if isotretinoin is the system-wide approach, think of this one as the sniper rifle. It's a highly targeted injection that surgeons use to solve very specific, localized problems that can pop up during the healing process. And the main problem it targets is something called a polybeak deformity. It's kind of what it sounds like. After surgery, sometimes this stubborn little pocket of swelling and scar tissue forms right above the nasal tip, and it creates this rounded, kind of beak-like silhouette. As you can imagine, it's a common reason for a patient to be unhappy with their result. And this is why we call it a precision tool. Get this, one major study found that these targeted little injections resolved that polybeak issue in up to 75% of cases. I mean, that is a hugely effective non-surgical fix for a really frustrating problem. So how does it pull this off? Well, triamcinolone is a corticosteroid. When a tiny, super precise amount gets injected right into the problem spot, it basically shuts down the local inflammation and tells the body to stop building up so much dense scar tissue. It essentially dissolves the problem right from the inside out. Okay, so we've got these two very promising treatments. But how good is the actual science behind them? Let's take a look under the hood at the scoping review that pulled all this information together. Now, this chart might look a little complicated, but all it really is a roadmap of the research process. It shows how scientists started with this massive search across all the medical databases to find every single study that might be relevant. Let's just break it down real quick. They started with 130 potential studies. Then, through this really rigorous process of screening and assessing, they filtered them down and down and down until only the 16 highest quality reports were left. That final, elite group formed the basis for their conclusions. That's scientific rigor in action. So here's the final report card, if you will. The evidence for isotretinoin helping with that early swelling gets a moderate certainty. That's pretty good. It means the effect is consistent. Now for triamcinolone, the certainty is low. Now that doesn't mean it doesn't work. The results we see suggest it really does. But it means we just don't have enough of the absolute gold standard studies, those randomized controlled trials, to be 100% sure.
Okay, so let's pull all this together. What's the big picture here? What do we do with all this information?
So here's the crucial point, and if you take away one thing, this should be it. These aren't competing drugs. It's not about one being better than the other. They're different tools for different jobs. Isotretinoin is for managing that widespread early swelling, and triamcinolone, that's the precision tool for zapping specific localized bumps that might show up later in the healing game. And this is probably the single most important takeaway from this entire review. These drugs are helpers. They are aids. They are not a crutch. They cannot, under any circumstances, fix a poorly performed surgery. The foundation for a great result will always be the skill and the technique of the surgeon.
So let's just sum it all up. For patients with thick skin, healing after a nose job is its own special challenge. Isotretinoin can make those tough first 6 months a whole lot better and improve patient satisfaction. Triamcinolone is an amazing problem solver for specific issues like that polybeak deformity. And while all of this is incredibly promising, the scientific community is clear that we still need more high-quality research to really nail down the absolute best ways to use these tools.
Which leaves us with a final question to chew on. As our understanding of the healing process gets more and more sophisticated, and as the evidence for these treatments gets stronger, could we be looking at a future where managing recovery with medication is just as standard as the surgery itself? It's definitely something to think about.